Today, I want to talk about straight up points because you need to understand by now you're fooling yourself and you're living in a dream world if you think that we're getting better when it comes to our health and our lifestyle, which is the number one killer disease across the world right now: cardiovascular disease, diabetes, and cancer. Why is it getting worse if we have more medication, if we have more cardiologists, if we have more nutrition, if we have more information? We have AI that can tell us what to do, when to do it, and how to do it. Sometimes we got to step back and reflect what's going wrong. What's going wrong with us? Are things really getting better? I just got off a call this morning on World Heart Day, and a lot of things make me angry. Traffic makes me angry. It creates that I've gotten better at handling it because it's not within my control. But you know what makes me angry? When you have a patient whose mother is out of the ICU after about 3 to 4 days. Okay, she's in for a heart condition. She has an allergic reaction to the dye in her angioplasty. All good, all good. And then she asks her doctor on discharge, a top cardiologist, doctor, yes, I got your prescription, I got your medicine, and what about my diet? And you know what the doctor says to her? What diet? Just go out and enjoy your life. The stent I put in your heart is good for 15 to 20 years. Enjoy yourself. You don't need to be on a diet. This is one of the reasons why we're getting sicker and sicker, because of information like this. Sometimes I really believe that it's a business. There are great doctors out there, noble doctors, and then there are crappy doctors. There are dishonest doctors, like there are great nutritionists and dishonest nutritionists, great personal trainers, dishonest personal trainers, great lawyers and dishonest lawyers. It's everywhere. And unless we wake up to understand that we got to get smarter and really understand why cardiovascular health is getting worse, that's the only time things are going to get better. A lot of people love to blame it on genetics. And there's a new science that's not new anymore. It's been out there for years, and top doctors from around the world talk about epigenetics, that even if it's genetic in your family, it doesn't have to happen. Your risks are higher, but it does not have to happen because of something called epigenetics, where we can control the upregulation, downregulation, and expression of our genes by changing our lifestyle. But people love to hear it's genetic because they just take the whole personal responsibility of themselves that, hey, it's genetic. There's nothing I can do. My doctor said it's genetic. Well, there's a lot that you can do. A lot of the reasons why we're sick today is because we're lazy. We don't want to take personal responsibility for our health. We believe that if we're put on a statin, our heart should function just fine. But then you have these angry patients who come and say, hey, Luke, my mom died, my dad died, my brother died. We did all the scans, we did the CTs, we did a bypass, we did all of that. We took statins. Why did he or she die? And when you ask them if they change their lifestyle, we don't know we have to change our lifestyle. You got to understand right now, while your stent may be life-saving, while your bypass may be life-saving, while you may need a statin, most people don't need statins. A few people need statins. While you do all of those things, whatever's right or wrong, are you changing your lifestyle? Because I can tell you right now, and you can get any professional to debate this. And I'll tell you why. On our podcast, which is the top health podcast in the country, we have the top cardiologists on these podcasts. And 1% of the podcast is where they talk about medicine. 99% of the podcast where they're telling you and patients, sleep better, eat better food. If you're fasting, fast the right way. Exercise consistently. Watch your stress levels. Now, this is what heart information is that you need on World Health Heart Day or whatever it's called. I don't even know why we have a day to celebrate things which are not improving. And you may think I'm being sarcastic and negative. No, I am a little bit angry about these things because human beings don't want to take personal responsibility for their health. They want to outsource their heart and their problems to the doctors and just believe what they're told. Believe what they're told, but understand. If you have a doctor who's telling you to eat what you want, if you have a doctor who's not talking to you about the importance of sleep, how your stress levels could have caused your heart problems, how your lack of exercise could have caused your heart problems, you are with the wrong doctor. You're with a doctor who only wants to treat your symptom. The same way you go to a nutritionist who tells you, oh, don't listen to your doctor, don't take your medicines, eat my natural food and you'll be sorted. You're with the wrong nutritionist. Everything has to be in balance. Everything has to talk together. And I'll tell you today why people have weak hearts and poor hearts in health. The number one reason, if it's genetic, you can get it treated. But are you changing your lifestyle? There are tons of cherry-picked signs originating in the West, finding themselves their way on Instagram, and all over our country, filling our minds with the next nutraceutical, the next superfood, and all that nonsense. What about the tons of research directly correlating your sleep deprivation with your heart problems? Whether you're a senior citizen, you're 50, 40, 30, 20, or a teenager, there is a direct correlation of sleep deprivation with poor heart health. The second thing, there's tons of research. Ask yourself, why isn't it reaching the limelight? You can't make money out of that. You can't make money out of telling people to sleep better. You can't make money or drama out of sleep deprivation, right? But hey, the science is real. Neurologists know this, cardiologists know this, everyone knows the impact of sleep deprivation, but why don't you know it? Why isn't it told to you when you're put on a statin? Why isn't it told to you before and after you finish a bypass? I want you to reflect and think. I'm not trying to trigger off hatred and anger in your mind. I'm asking you to just come down to one thing. Not many people care for you. Okay, you need to take personal responsibility for your health. Period. It's as simple as that. So sleep deprivation. What about the tons of research that emerge every day about the connection between your chronic stress, anxiety, anger, rage, negativity, suppressed emotions with cardiac problems? It's all there. Why isn't it reaching you? Because you can't make money out of that. No one can make money out of that. You can't make a nutraceutical out of that. The point is, these are some of the largest causes. And then you come down to junk food. Look around. Look around at the amount of people eating fast food, junk food, crappy restaurant food, Swiggy and Zomato food still being served in plastic containers, and all of that. And then we wonder why we're getting sick. Even though you're working out, you got a new gym membership, you're buying some expensive probiotics from the US, and you think it's all good. But the point is, we're missing the basics and the fundamentals. So you have chronic stress, you have sleep deprivation, you have our bad nutrition, our junk food, and all of these things that we think a nutraceutical, L-carnitine, will safeguard my heart. That's such a load of bull crap right there. L-carnitine, great on paper, on your AI chat, can be used very strategically when you're training, when you're trying to lose weight, very strategically. But if you think you can take an L-carnitine and expect your lifestyle not to change and not have a heart problem, well, guess what? You have a heart problem. It's as simple as that. Your body's always trying to tell you what's wrong. You ignore it. You're fatigued. You're breathless. You're getting palpitations. Your HCRP is on the higher side. Your CRP is on the higher side. So many people are scared to do their 2D echoes, their stress test, or even a simple 100-rupee test called an ECG. And the point is, if your early screenings are not in place and your lifestyle is poor, that's when it hits you suddenly. And what is that called when it hits you suddenly? Cardiac arrest, a heart attack, or whatever it is, a stroke, paralysis, because we're waiting, we're living our poorest lifestyle, we're working hard, we're doing all of these things, we're burning out, and we just think we can take supplements, take medications like Band-Aids to solve the problem. But you're still getting a heart attack, you're still getting blockages, you're still having all of these issues. Understand, your body's always talking to you. Don't ignore fatigue. Don't ignore your early screening tests. Don't ignore breathlessness. Don't ignore sleep apnea. I can't tell you how many people right now, probably watching this outside there, got undiagnosed with sleep apnea. They don't understand. They're falling asleep the moment the car starts moving. They're waking up tired, not sleeping well at night, constantly fatigued throughout the day. They have a metabolic syndrome. Get yourself checked for sleep apnea, because if you don't and it aggravates, you can have a cardiac arrest. How many people living with metabolic syndrome? What is metabolic syndrome? You have high blood pressure, and you have diabetes, and you have high triglycerides, and you have low HDL. All of these things together, metabolic syndrome. Keep it going, CKD, chronic kidney failure. The point is, you can treat all of these separately, but you got to join the dots at some point and understand, why does my body have a metabolic syndrome? That's not genetic. Maybe the heart part could be genetic, but your diabetes type 2 isn't. Your high blood pressure isn't. So you can't just blame it on the genes. You got to make lifestyle changes. So what are these lifestyle changes that we're talking about? Let's Google the 10 best foods to lower triglycerides. Let's Google the 10 best foods for heart health. Absolutely useless at every angle. Because when you look at cellular nutrition, you need to understand what defense mechanism does the heart need? Angiogenesis. My heart right now, I don't know what's happening in it. I could be having a 20%, 30%, 80%, 90% blockage. Okay, my immune system has to be so intelligent and strong to realize that when there's a blockage, okay, my heart already starts the process of angiogenesis, growing new capillaries, blood vessels. Angiogenesis are your blood vessel growth. So your blood vessels know when to start growing and know when to stop growing. So like it's a real roadblock. Okay, there's blood flowing through my artery. It reaches a blockage, struggling through. Okay, angiogenesis grows a new capillary. Okay, and blood starts flowing. So I'm asymptomatic. I don't have a problem. My pressure doesn't increase and my blood continues to flow. Think of it like you're in a crowded city. I'm in Mumbai right now. Okay, there's a traffic jam, but I know a by-lane. Okay, and I'm in that traffic jam. I take a right and I move down the by-lane. Angiogenesis, new capillary, helps me get through. The point is, we don't understand this. We're eating foods that decrease angiogenesis. All of our fatty foods, our junk food, our sugar, our refined carbs, our over drinking, alcohol, smoking, vaping, and all of those things. It's not setting the environment for your heart to look after you. It's very rare that you won't find someone with a blockage. You can find teenagers with blockages starting to build in their arteries, plaque starting to build in their arteries, but you shouldn't have to worry because your body should be intelligent enough to navigate through this through a process of angiogenesis. But we're not eating the right foods. We're eating the wrong foods that actually prevent angiogenesis from being intelligent enough. So you have your sleep and then you'll have a ton of excuses, but fix it. Fix it. It's your problem. Take personal responsibility, learn what you need to do to sleep better. There's a ton of information out there, and then take personal responsibility, add a little bit of discipline and consistency, and fix the problem. Fix the problem. You have too much of stress in your life? Fix the problem. Take therapy, speak to people. Have you become too ambitious in the name of being greedy, taking more on your plate, more responsibilities at work, open more businesses, and now you're taking the stress of all of that stuff? Whose fault is it? Mostly your fault. Because you don't know how to draw boundaries, you don't know how to say no, and you don't know how to live your authentic self because you're comparing your lives with people all the time. And then there are genuine people who have genuine stress, but they learn how to live with it. There are things called faith, spirituality, meditation, a hobby, exercising to reduce stress, nurturing great relationships, getting out of toxic relationships. Everyone knows this, but we have a lack of action. We have a lack of personal responsibility. So on today's day, I don't want to talk about frivolous things like eat this food, drink more water, exercise more. Everyone knows it. I want to talk about the hard truth that most people know what you should do, but you should be asking yourself, why am I not doing what I'm supposed to be doing? Period. You can blame it on the kids, on your schedule, too much of travel. That is your problem. You still got to take personal responsibility to fix your problem, because I can promise you a stent, a bypass, your statins, your L-carnitines, all your antioxidants are not going to do that job. They're supportive, but they're not going to fix the problem that you should be fixing with the right action. Let's talk about exercise. There's so much awareness, but yet people don't exercise the right way. You still find people stuck on the treadmill, the cycle, the elliptical, only doing cardio. When your heart is a muscle, your endocrine system is muscle, you need to be training muscle. Whether it's resistance bands, whether it's weight training, whether it's calisthenics, you need to have a combination. And this is not because Luke's telling you. It's what your body needs. Your body needs anaerobic. Your body needs aerobic. It needs flexibility, VO2 max. It needs endurance. It needs stamina. All of these things. And you'll have, but I'm this, but I'm that, but I'm too busy, but I'm all of that stuff. And that's the problem. Our buts create the biggest issue, moving us to the right kind of action. So we spoke about sleep, we spoke about stress, we spoke about exercise, all of that. What about insulin resistance? We are the diabetic capital of the world. Is this something we celebrate on a World's Diabetes Day, or do we feel shameful? In our country, we are the diabetic capital, and this diabetes is not below poverty line. It's in our urban population that is educated, that knows what to do. They are type 2 diabetic. And my point is, it's a lifestyle problem. And people, oh, but my dad had diabetes. Type 2 diabetes is not genetic. And even if it is genetic, it is completely 100% reversible. But you're not reversing it because you want the easy way out. Blame it on my genes. So if you have insulin resistance, your risk of cardiac problems increase. If you are diabetic, your risk of cardiac problems increase. So if we're the diabetic capital of the world, you can forecast how cardiovascular disease goes hand in hand with insulin resistant, being the diabetic capital of the world, and metabolic syndrome. I forgot to add one more part to metabolic syndrome. You have high triglycerides, low HDL, diabetes, high blood pressure, and you're obese. A lot of abdominal midriff fat. That makes up metabolic syndrome. Get your scans done early if you have these risk factors. People love to spend money on alcohol, drugs, vaping, expensive holidays, but ask them to do a simple test. They don't want to do that. Running a marathon, starting the gym, getting into heavy workouts, you don't know how your heart is. That's your ego. You're motivated. Get a simple ECG done. A simple $100 ECG done before you start getting into heavy running, heavy weights, or whatever it is. I don't want to go on about smoking, vaping, and drugs. Weak people will always want to find ways through it and around it. It's very, very clear. You continue to smoke, you continue to vape, you continue to do banned recreational substances over and over again. You're putting the stress and burden on your heart. It's as simple as that. There's something called acute load. A lot of people today are dying in corporates. A lot of young people are dying, and people are still blaming the vaccine. Whether it has an effect or not, we don't know about that. And if it's true, so let's agree. It's true right now. But don't just stop over there at the vaccine. What about your lifestyle? You know the amount of people who finish a heavy workout and go out and vape? Or the people who vape before going into a gym? That's something called acute load on the heart. People work out in the gym and show their best Instagram picture, but they won't show you the dirty part of their life. Their late night sleep deprivation, smoking, vaping, pornography, all of these things are acute load on the human body and vital organs. And that's what you got to be careful of. Get your dental health checked as well. It is so important for you to schedule your regular once in a year appointment with your dentist, because your dental health has everything to do with your heart as well. So I think we need to understand today that I'm tired of all the crap that we keep hearing about the latest drug for heart health, the latest drug for cancer, the latest whatever, and look at people's lifestyles. Their basics and fundamentals are not in place. The basic foundations are not in place. But yet we want to talk about the latest pharmaceutical drug, the latest nutraceutical. Why? Because that can make people rich. You are the consumer. It's making someone else rich. Why isn't anyone going on and on talking about sleep, stress, food, exercise? Because you can't make money with lifestyle. And that's why you build onto people's fears, more and more onto people's fears and all of that stuff. So I want everyone to understand on World Heart Day today, take personal responsibility. Have the best cardiologist in the world, nutritionist, but are you doing what you should be doing? Your statin is useless without you sleeping deeply at night. Your statin is useless if you go on chain smoking every day. Don't think you're going to get better and better. In fact, your statin is doing you more harm then, because you have so many things working against you, stopping cholesterol, which is needed to fix your brain, to fix your cells, to fix an injured heart. It's a vicious cycle. Get on a statin if you have to, but then work with your doctor and work with your lifestyle so that you can get off the statin, because your lipid profile is getting better. Your blood sugar levels are coming better. Can you get off the statin? Absolutely, yes. When your levels have all come down, your doctor has no reason to keep you on a statin. So you got to do that with your lifestyle changes. You got to tell your doctor, you're medicating me. Okay, doc, I'm going to take it. I know I need to take the meds right now, but I want to change my lifestyle. I want to work with you, change my lifestyle. And as my levels come down, I want you to reduce my medication. That's how every human has the right to age. As we age, we should have less medication, not more medication. So I want all of you to stop blaming your genes, all of you to stop being dependent on a medication alone. If you have a doctor who's told you, I've given you a med now, it's okay, go enjoy your life. Your doctor doesn't care about you, period. Your doctor does not care about you. If your nutritionist tells you, hey, I don't believe in statins, get off your statin and only eat my food, your nutritionist doesn't care about you too. It's as simple as that. We will always need a balance, a fine balance of everything. Sometimes we may not need it. Sometimes we may need it. Do what is right. But my only message to you on World Heart Day is, are you taking personal responsibility to overcome the excuses and lies that you tell yourself every single day about missing a workout, not being able to eat the right way, screwing up your sleep cycles, and constantly stress. You are stressed, figure it out. Figure it out. Learn how to deal with it. Learn how to accept. Learn how to let go. Take classes. Take therapy. But if you're not putting effort in to get better, that is your fault. That is your fault. You can't go on blaming the whole world and everything for your problems. It's a tough world. It's also a beautiful world. And is everyone dying of a cardiac arrest? Is every corporate employee dying of a cardiac arrest? Is every pilot, every air hostess, cabin crew dying of a heart attack? Is every teenager dying of a heart attack? Is everyone who took the vaccine dying of a heart attack? Let's stop making excuses, okay? While there's the few odd ones out, when you break down the cases of all these people, you'll find a poor lifestyle behind all of them. And that's what we're here to change, our lifestyle. Have a great day, everyone. Until next time, eat smart, move more, sleep right, breathe deep, and remember, you care is all about you.